So this talk it bridges some information we touched on earlier. Particularly, we start thinking about chronic infections. It raises the question, if you were going to use tryptophan versus 5-HTP, what might be better? It's going to go a little bit into the history of tryptophan use. It's going to talk a little bit about brain inflammation, bridging the gap between autism and Alzheimer's. It's going to touch on how Candida could possibly be a problem for individuals with Alzheimer's, for example. I thought Dr. Shaw coming up and reinforcing that information about Clostridia and dopamine was important as we start to think about the implications of what happens in the digestive system and the impact it can have systemically on the brain and nervous system, et cetera. So there's a little bit of a lot of things in this. And there's a little bit about vitamin D. So I've kind of thrown a number of things here, trying to kind of weave through this information to kind of try and bind it to something cohesive that can be linked back to the organic acid test, but also applicable across multiple disciplines in medicine. Oh, okay, before we do that, I just want to show you a test of, and this is an example, and I threw it in here because there wasn't a lot of space in the other lectures and time-wise. So this is an example of an organic acid test of an individual where we see very high levels of Clostridia and very high levels of dopamine and what can potentially happen. Notice that the arabinose marker, remember, first time you look at an oat, when you look at page 1, your eyes should go towards arabinose, right? It's Candida high. Okay, it's just mildly so. Bottom of page 1 is markers indicating bacterial imbalance in the gut, and then what's the next two markers we want to look at on page 1? 16 and 17, okay? And notice in this particular case that HPA is normal. But notice the creosol value, okay? It's very high. Also notice that 4-hydroxyphenylacetic acid is high. We know that 4-hydroxyphenylacetic acid can come from Clostridia too. So, do we have a problem with Clostridia? Is that a given? I think that's pretty evident from the test. Remember, what's going on biochemically with the HPA4 creosol, and I'm going to say likely some of these other phenolic compounds that these bacteria produce. It inhibits the dopamine beta hydroxylase. We can get an elevation of dopamine and get a spillover effect by measuring HVA or homovanillic acid off the oat. In this particular case, the HPA was normal. It was being driven primarily by creosol, possibly to inhibition because of that 4-hydroxyphenylacetic acid. There is the homovanillic acid marker, okay? That's very, very elevated. One of the highest that I have seen, okay? So we clearly have an issue of inhibition. Now, it's possible in this individual, maybe there's a polymorphism in the dopamine beta hydroxylase enzyme. As Dr. Shaw was pointing out, you can have people who just have low function of DBH, of this enzyme DBH, where it just doesn't make adequate conversion, and that causes a rise that way. So, with that high a dopamine, you would think that we would see some types of oxidative stress markers, or depletion of glutathione, for example. Now, there's a number of different products on the market that can be very high in tyrosine, okay? Tyrosine powder straight up and some other products here that some people can take based on certain protocols that by themselves may not necessarily be a problem, but potentially in the presence of Clostridia could be a problem. And that's, essentially what was happening here. Notice what's interesting, though, and Dr. Pratt was commenting on this. Remember, the pyroglutamic and the 2-hydroxybutyric are linked to the production of glutathione. They're indirect markers, meaning that if there's an elevation of those markers, there's a deficiency of glutathione. But look at the pyroglutamic marker. It's high normal. It's just right up against the ceiling. Would you think that it would be higher in a dopamine level or HVA level of over 500? Well, I can tell you from my experience, yes, you definitely would expect that and probably should be. But why is that not happening? Well, it turns out that also what's being used is a product with high levels of cysteine, okay? Cysteine, N-acetylcysteine, is a precursor to glutathione. So it's possible what's happening is that enough cysteine is being pushed to produce glutathione to combat the high levels of Clostridia toxins and the high level of dopamine to keep the pyroglutamic marker just barely normal. At least that's what I think is happening. One of the other interesting things on this, and this just comes from the last page of the organic acid test under the amino acid metabolites, was this marker, number 72, 4-hydroxyphenylactic acid. The level is not extremely high, but this marker is linked to what's called tyrosinemia, which is a metabolism problem with regards to tyrosine, which can lead to elevated levels of tyrosine in the body. Okay? Now, if you think about that, if there is a blockage somehow in being able to convert tyrosine, you get excess tyrosine accumulation that can't move beyond that step. And if you've got Clostridia that's sitting there, specifically the creosol is where that Clostridia is grabbing onto that tyrosine to sit there and produce more creosol. And that compound is just sitting there banging on that dopamine beta hydroxylase. At the same time, maybe that's what's happening, but this person is also on a lot of tyrosine supplementation. This level isn't to the point where it would be considered a genetic disease. It's probably some type of just low-level, maybe polymorphism in the converting enzyme where it just doesn't function optimally, perhaps doesn't even show up unless somebody is pushing it with a lot of tyrosine supplementation, okay? But it's just sort of an extra little piece that tends to fit this picture a little bit with regards to the oat. Primarily, I don't see this marker that often, but if I see it anymore, first thing I'm thinking of is how much tyrosine you're on, is it linked possibly to Clostridia, et cetera. Okay? So that was just a little bit of a sidestep. I think it was an interesting scenario how it fits in a bit of what we've been talking about. So now let's come back to what the primary lecture here is all about. We've gone through the neurotransmitter aspect with regards to HVA, VMA, dopamine, etc. Now we're going to focus on the tryptophan metabolites. It's a fairly common scenario on the organic acid test to see low normal serotonin and sometimes a slightly high quinolinic 5-HA ratio. Okay, the chemistry and the biochemistry, again, in these pathways is complicated. We know that tryptophan is used as an amino acid source, not only from our cells, but by bacteria as well, including our microbiome. We know that microbiome can have a problem in processing things like these amino acids if there's a lot of glyphosate. But tryptophan also can form and move into the serotonin pathway, producing 5-hydroxytryptophan, which then becomes serotonin. A lot of the serotonin produced is in the digestive system. But tryptophan is also linked, as I mentioned earlier, to the quinolinic acid pathway. Too much quinolinic acid is cytotoxic. It does have some antimicrobial properties itself. And what's being measured on the oat is not only the quinolinic acid, but also this 5-hydroxyindoleacetic acid as an indicator of serotonin production. And as Matt said, or Dr. Pratt said, again, we're not specifically talking about brain neurotransmitters. It's systemic production through the body. Now, with regards to the tryptophan story, it really starts with this whole aspect of these large neutral amino acids, okay, that can compete with tryptophan's entry into the brain, moving across the blood-brain barrier. A lot of times, these branched-chain amino acids can have an assertive ability at blocking the transport of tryptophan, but also it's been reported that some of these Clostridium-modified amino acids can as too. And I'm having a hard time finding the exact mechanism here with regards to what actually biochemically, at what receptor site or whatever is occurring. But this has been something that has been looked at, that these large neutral amino acids can block tryptophan's crossing of the blood-brain barrier. And so the body actually has the ability to kind of regulate these amino acids. One of the things that helps to increase tryptophan's movement across the blood-brain barrier is by lowering these other amino acids, specifically these branched-chain amino acids. And it's felt that high carbohydrate diets will stimulate insulin, and insulin can actually lead to a lowering effect here, which then opens up the ability of tryptophan to cross the blood-brain barrier. And this is felt that this may play a role in that feel-good effect that people often get on a high carbohydrate diet because they're intaking tryptophan more, being converted to serotonin, etc. And that over time, people are on a high protein diet with not enough carbs, etc., can start to feel kind of lethargic and kind of lousy and depressed. And so at times, the use of supplements can be helpful, whether it's 5-HTP or tryptophan. And it's felt, and what I think I'll kind of tell you the punchline here, based on this talk, that 5-HTP may be preferred because biochemically it cannot be converted to quinolinic acid. Okay, so we'll get there. This is not the most impressive study, but it just reinforces a little bit about this talk. This came out in '76. It was only a study done for 7 days. There was only 14 people that were part of it. And they took 150 milligrams of 5-HTP orally, and they had mild to moderate, depressive symptoms. And what they found, though, what was interesting was that the individuals who had the lowest levels of 5-hydroxyindoleacetic acid, the 5-HAA in the urine, were the ones that were non-responders at all to the 5-HTP. Anybody here use 5-HTP in your practice? I mean, I use it a fair amount with some of the kids I work with. And your overall impression has been? Yeah? Okay. Anybody doing tryptophan? I mean, some people respond better to tryptophan too, so I'm not sitting there saying you should take tryptophan off the table, but yeah. Okay, so where am I? Let me orient myself. Oh, there we go, okay. So the low serotonin metabolite, okay, and a semi-high quinolinic acid ratio, pretty common scenario. Now remember, every time we do an OAT or do any test, it's a snapshot in time. If we could do testing every week and track it on a patient over many months, you'd see, some slight changes, and you might see certain things happen dramatically and depending on what they're being exposed to. So I look at this section as maybe a bit of a spectrum of what possibly is happening and where people might be heading. Sometimes you'll see the quinolinic acid levels come back high just by themselves, and that's certainly more concerning because of the neurochemical toxicity that quinolinic acid can have all by itself. To take this a little bit deeper, let's look at an enzyme called tryptophan hydroxylase. And this brings in some interesting information about vitamin D, another reason to be doing vitamin D testing. Tryptophan hydroxylase is the enzyme that converts tryptophan to 5-hydroxytryptophan, okay, or 5-HTP, and then eventually that's converted to 5-hydroxytryptamine or serotonin. This was a paper that came out a couple of years ago. It was talking about vitamin D being a regulating nutrient over serotonin production. And they were relating it to autism, because what they have found is with autistic kids, they tend to have high blood levels of serotonin and low brain levels of serotonin. Well, it turns out there's two forms of tryptophan hydroxylase. There's TPH1, which is most active in the gut. And this is what helps produce serotonin in the gut. It's felt that, at least from my research, maybe some of you have read something different, that serotonin produced in the gut doesn't have any appreciable effect of serotonin in the brain. So it's almost like the compartments are somewhat separate. And there may be other information out there that I'm not aware of, but I don't think the effect is significant. The role of serotonin in the gut can help with platelet aggregation. It can help with some aspects of gut contractility. I'm not sure of serotonin's effect on the migrating motor complex, but I wouldn't be surprised if it helps with that too. TPH2 is most active in the brain and central nervous system. Okay? Let me go back. So what's felt to be happening is that vitamin D interacts with something called a vitamin D receptor element. The VDRE, when it complexes with vitamin D, will downregulate TPH1 activity in the gut, causing TPH activity to drop in the digestive system, reducing serotonin produced in the gut, at the same time increasing activity of TPH2 in the brain. So the bottom line is when we have a normalization of vitamin D, we have a greater chance of improving brain and central nervous system serotonin through increased activity of TPH2 and reduced production of serotonin in the gut. So another way, the reason I'm tying it in here is it's another aspect to serotonin production, and can be another reason of why people can get benefit by having adequate levels of vitamin D amongst the million other things that have been looked at with regards to that nutrient. What are some various effects of elevated quinolinic acid? Well, here's the chemical structure of quinolinic acid. We know it's a byproduct of the tryptophan conversion away from serotonin being funneled through this kynarenic quinolinic acid pathway, basically. Well, chemically, it's known as a NMDA receptor agonist, so it can have a stimulatory effect in the brain and nervous system. It can be a neurotoxin, or has that effect, and it's been looked at in a wide variety of different types of diseases: Huntington's, Alzheimer's, mood disorders, body pain, suicide, etc. Here's the chemistry behind it. Here is our tryptophan, okay? Remember, tryptophan 2,3-dioxygenase and indolamine 2,3-dioxygenase help to pull tryptophan away from the serotonin pathway and funnel it down through the kynarenic acid to quinolinic acid stage. 2,3-dioxygenase tryptophan variety is many times activated because of stress, cortisol effects in the body. Well, turns out that immune reactions, infections, chronic infections, can also stimulate those enzymes too. So a chronic infection, viral infection, has the potential, Candida as well, to increase activity of indolamine 2,3-dioxygenase, pulling more tryptophan into the quinolinic acid pathway. Niacin is something that is known to help inhibit that conversion, and a niacin deficiency is something that is biochemically linked to the increased potential of increasing quinolinic acid in the body. What else does quinolinic acid do? Well, it is a substrate for nicotinamide adenine dinucleotide. So it doesn't, again, it's not all bad, and it has a supportive role as well. I'll mention this phthalate issue here at the end. Remember, we need a good supply of NAD to help spur on energy production at the cellular level. We've already talked about how Candida can interfere with mitochondrial function, how Clostridia can interfere with it, how oxalates can interfere with it, chemical toxins can interfere with it. So chronic infections, toxins certainly can interfere with our mitochondrial activity. Too much quinolinic acid has been linked to pain signaling increases with regards to inflammation. It's been linked to increased severity of arthritic pain and discomfort. Quinolinic acid is a known inhibitor of choline acetyltransferase, affecting acetylcholine levels in the brain and nervous system. It can interfere with glutamate to GABA conversion. One of the concerns over NMDA receptor sensitivity is excess glutamate triggering of those NMDA receptors in neurological disorders. There's actually medications like Namenda, which have been out there for a while to kind of block NMDA receptor activity. I've used Namenda in some autistic kids over the years to help with aggression and impulsivity. This slide is interesting. This actually comes from a paper on depression. There was a typo in here somewhere. See if I can find it. But it highlights exactly what we're talking about. Here's our indolamine 2,3-dioxygenase. Okay, it gets increased activity because of what's here in the yellow box. It shoves tryptophan through these pathways, forms quinolinic acid. Quinolinic acid has a stimulatory effect on NMDA receptor. We increase glutamate neurotransmission, et cetera, et cetera. And in this particular paper, they were talking about the effects on depression. Let's talk about a few of these. Interferon gamma, tumor necrosis factor, interleukin-1 beta. These are linked to the immune system. We touched on that a little bit this morning. Some of these get produced when the immune system in the gut is engaging invasive Candida. These things can also be produced because of other pathogens as well. Bacterial infections, parasitic infections, cortisol, LPS. So LPS is lipopolysaccharide. And again, who here is working with people with small intestinal bacterial overgrowth? Okay. For those of you who aren't, SIBO is a condition where people are accumulating normal colonic bacteria in the small bowel. Okay, so normal bacteria, about 90% of our microbiome lives in the large intestine, but for some reason or another, whether it's an anatomical problem with the ileocecal valve or they've been on proton pump inhibitors forever, they're starting to backflush or accumulate normal colonic bacteria in the small intestine in places where it normally shouldn't be. Many of these bacteria are gram-negative bacteria. Gram-negative bacteria, as part of their cell membrane, contain lipopolysaccharides. And the mucosal barrier in our digestive system, and one of the reasons we produce mucus and secretory IgA at very large amounts, is to try to buffer activity of lipopolysaccharides, because even just normal bacterial turnover and activity, even in the colon, will produce LPS. And lipopolysaccharide is also known to affect the tight junction, or the tight junction that is influenced or influences leaky gut. LPS actually, I think what it does is it attacks the actin-myosin bridge that's part of the epithelial integrity that keeps cells together. They're looking at LPS now with regards to metabolic syndrome, because it will increase insulin resistance. Lipopolysaccharides can also be a trigger for microglia activation in the brain. A lot of people with SIBO, as I mentioned before, tend to have a lot of anxiety, and that's felt in many parts to be triggering reactivity in the amygdala. So there's a lot of interaction that happens between the microbiome in the brain, not just because of pathogens, but because of normal inhabitants within the digestive tract. In SIBO, it just happens to be generating from the small intestine. Well, LPS is also a trigger of indolamine 2,3-dioxygenase. Okay, so lipopolysaccharide production from the gut can trigger activity of these enzymes too, increasing the potential for quinolinic acid production. Here's a slide based just exactly on that. So here is our gram, where is it? Yeah, gram-negative bacteria. So LPS, part of that cell membrane. Insulin resistance, microglia activation, pro-inflammatory trigger. E. coli, Enterobacter, Klebsiella proteus, Pseudomonas are all gram-negative bacteria. This is why people with SIBO have so many different types of problems. It's a really complicated disorder emanating from the gut. They've looked at quinolinic acid with regards to Lyme. I'm not a Lyme specialist. Anybody in here treat Lyme? Okay. Lyme is a whole specialty in itself. But they've looked at quinolinic acid because one of the things, again, it's an excitotoxin and an NMDA receptor agonist. Some of the problems they feel in Lyme may be linked to quinolinic acid. As I mentioned, quinolinic acid does have some effect at a cellular level with regards to microbes. There's a number of things that will cause its production. Beta amyloid. Okay, what is the link between beta amyloid, which is linked to Alzheimer's, and Candida? What's this all about? Well, before we get there, let's talk a little bit about brain inflammation and what can happen when microglia and these pro-inflammatory things get mediated or produced, triggering things in the brain. Now, in autistic kids, many of these kids tend to have a lot of brain inflammatory problems. This was a paper that came out in 2005, so the information isn't really new, but it is definitely important. This actually came out of Johns Hopkins University School of Medicine. And what they did is they analyzed the brains of a number of individuals with autism who died from injuries and accidents. So here's how it broke down. They looked at 3 different regions of the brain in 11 deceased individuals, the ages 5 to 44. And then they looked at immune chemical cytokine profiles of cerebral spinal fluid in 6 living individuals with autism. And what they found was that there was active neuroinflammatory processes occurring in the cerebral cortex, the white matter, as well as the cerebellum, which we talked about earlier in that study that was linking Clostridia tetany toxin going through the vagus nerve. Marked activation of microglia, and a lot of these pro-inflammatory cytokines were also elevated. So they just discussed the fact that there seems to be some neuroimmune reaction causing some type of pathogenic role in autistic individuals. And there's been many other studies that have now correlated this too. Alzheimer's is another area, clearly where they're looking at brain inflammation, microglia activation as well. So we can get receptor sensitivity to glutamate or other compounds that can interact with these NMDA excitatory receptors. That can lead to influx of calcium, reactive oxygen species, breakdown of brain cell integrity, etc. The medication Namenda, which I had mentioned before, has been around for quite a while. Been used to help block those NMDA receptors. It's approved for Alzheimer's, usually mild to moderate. I've used it at times with some individuals on the autism spectrum. Very difficult to get anymore because most insurance companies aren't willing to pay for it. It's expensive because you're wanting to use this in a 12-year-old? How does a 12-year-old have Alzheimer's? So totally ridiculous. I actually had one individual in my practice, was a 27-year-old man, had a severe reaction to the DPT vaccine back in the late 80s. Totally normal, became severely autistic after that. And the only thing that worked for him was this. It calmed him down, he was functional, he could help out around the house, he was still living at home. Other than that, when he wasn't on this, he was impulsive, he was aggressive, his anxiety was very high. It was amazing. And it was quite a battle to be able to continue to get Namenda for him. At times, if you just think about the mechanism of these things, sometimes you can hit it with nutrients. Not always. The difficult thing in trying to match up supplements to medications, I think a lot of times comes down to receptor sensitivity and specificity of how these things work. L-theanine is a nutrient that is found in green tea. It can be taken concentrated in a supplement form. It has some Namenda-like properties, okay, helping to nullify some of the excitatory effects of the NMDA receptors. Lithium, I don't know if Dr. Greenblatt, Lewis, do you know if Greenblatt is talking about lithium at this? He's got to be talking about lithium at this IMMH conference. So he has a whole lecture on that, a whole book on that, but nutritional lithium can be extremely useful too. The reason I'm showing this to you is I'm going to talk to you about a case later this afternoon where I incorporated a number of these therapies, including nutritional lithium. New Beginnings Nutritionals has, I don't know, maybe some other companies here have some nutritional lithium as well. If you're not using it, it's absolutely worth getting familiar with. I really like the liquid lithium, which I can dose 1 drop, 2 drop, 3 drop, particularly for sensitive individuals or kids, and then of course the lithium orotate. I do a lot of hair testing. Hair testing is a useful additional test to learn how to use in your practice. It is a snapshot assessment for heavy metal toxins, but it also does a pretty good assessment of certain minerals. Not all minerals, but certain minerals, like lithium, for example, which can be often low in autistic kids. It's been seen to be low in schizophrenia, etc. And we know that lithium has a regulatory effect on brain excitation from NMDA receptor activity. But the real story comes down to these microglia. Many times these things get triggered to be chronically left open or left activated. I mean, they're doing what they're supposed to do, right? They're the main immune cells in the brain, and they're supposed to help combat anything coming into the brain. But when they get stuck in an on position, it just sits there and churns away and creates a lot of oxidative stress, which is what that study from Johns Hopkins showed with autism, what is also being shown in Alzheimer's, etc. And it's a real problem, this reactive microgliosis. Well, what are some triggers for microglia activation? I've already talked about lipopolysaccharide is a trigger. Beta amyloid. Okay, beta amyloid can also be a trigger for microglia activation. You can have inflammatory triggers, you can have endogenous things that get into the body, toxins and whatnot, and then of course you can get collateral damage on brain cells just because of these other neurotoxic factors, these reactive oxygen species that get generated too. This was a paper that was discussing the effect of beta amyloid activating microglia, being linked to Alzheimer's disease. Well, what's the deal with Candida? And what's the link to beta amyloid? Well, Dr. Shah was alluding to this when he was talking here. It turns out that beta amyloid is an antimicrobial peptide. This is just one paper example. Go online and start researching this, okay? This paper was talking specifically about beta amyloid being an antimicrobial peptide against bacteria. I think it even mentioned Candida. But this was the paper I believe that Shah was alluding to, was beta amyloid acting as a natural antibiotic in the brain. This comes from Mass General Hospital. Amyloid plaques, okay, may trap microbes. Think of the implications of that. I think I threw this other one in here too. Oh, yeah, this was just a separate paper I pulled up from the journal Translational Medicine in 2016. They were looking at amyloids developing on the surfaces to capture Candida albicans in culture medium. So, beta amyloids being a normal part of the innate immune system. Okay, so a lot to digest there, but I think hopefully what that does is kind of reinforce some of the stuff we've been talking about. Let's talk a little bit about the history of tryptophan. Tryptophan versus 5-HTP, what should you use? Okay, well, tryptophan was actually banned in the United States for many, many years. It was thought to have some toxicity, thought to likely be toxic because of some impurities in the compound. 5-HTP wasn't pulled off, but tryptophan was. So in 1989, there was a large outbreak of eosinophilia myalgia syndrome, about 1,500 cases at that time, a number of deaths, and they thought it was connected to some contaminated lot of tryptophan. So over-the-counter sales were banned in 1991 by the FDA, but prescription sales were still allowed, and then it was reinstated in 2002. And if you read the FDA statement, it's very interesting. Okay, based on scientific evidence, at present time, we can't determine with certainty what was causing the EMS. Perhaps it was some content from the L-tryptophan, maybe an impurity, maybe a combination of factors. In the New England Journal of Medicine in 1990, okay, they made an association with past tryptophan use and this scleroderma-like abnormality, okay, high eosinophils, etc. They measured kynurenine and quinolinic acid. Now, the numbers weren't real high. I think they looked at 4 patients and 5 normal subjects. But what they found was that, you know, they had this scleroderma-like condition. And I thought this paragraph was pretty interesting, okay? Talking about the development of the syndrome may result from the confluence of several factors, including the ingestion of tryptophan, exposure to agents that activate indolamine 2,3 dioxygenase, everything I was just talking about, and possibly impaired function of the HPA axis. I mean, that to me is like integrative medicine right there, coming right out of the New England Journal of Medicine in the early 90s. Well, this was a paper from Food Chemical Toxicology. What year was that? 92? Saying we've solved it. Okay, that we've solved the riddle here. Eventually, it became clear that the cause of this EMS condition was not the tryptophan itself, but rather flaws in the Japanese company that was producing it. Okay, that it allowed trace impurities to contaminate the batches, and these impurities were then in turn responsible for that late 80s EMS outbreak. So problem solved. This article came out in 2005 as a review article that went back and started looking at different cases of this condition and similar conditions, number of deaths, and actually found when they analyzed the Japanese company's lot that the purity levels were pretty high, okay, 98.5 to 99.6 purity. So was it cyanide in the sample? I mean, that's a pretty pure sample to be causing such a problem. Then they also looked at the fact over in the UK that there were other individuals who developed EMS, secondary to tryptophan use, that were taking tryptophan from another company not linked to the supply coming from Japan. Okay, so the Merck product, this Optimax, was unrelated to the Japanese contaminated product, but other people were still developing this condition. Then steps in this person, okay? So this individual decides, I got a great idea. How about I inject myself with quinolinic acid and see what happens? So it did subcutaneous injections of quinolinic acid over a month and then measured eosinophil counts over about a 5-week period of time and then did tissue samples to look at things histologically. And what did they find? Well, they found that there was an increased role and increased infiltration of eosinophils leading to a cutaneous eosinophil disorder, not because of tryptophan, but because of quinolinic acid. So tryptophan, we know, is a major source of quinolinic acid production, whereas 5-HTP is not. Is that blurry? It's pretty blurry. Once you're at the step of 5-HTP, you're committed towards serotonin. It can't go backwards. But you're not committed if you're at the step of tryptophan. Tryptophan can go this way or that way. So there's much more influence in the body, chronic infection, stress, on tryptophan than we think with regards to serotonin. So the question is, what's better? Everyone here who raised their hand on 5-HTP would like it. There's people in here who've used tryptophan. Okay? It's not that tryptophan is bad and 5-HTP is better, or vice versa. It's based on the clinical situation. One of the reasons the oat is so useful is if you have the presence of chronic infections, you have to be careful and make sure that you're not going to drive the quinolinic acid levels higher. If you already have quinolinic acid, then it's probably safe to say you might want to choose the 5-HTP over the tryptophan because you don't want to feed that pathway a little bit more. Now, the first oat seminar we did a couple of years ago was in Seattle. And there was a practitioner that stood up and brought up a good point. He goes, back when a lot of this was going on, there was a movement, maybe some of you remember this, people were mega dosing tryptophan, right? It was the magic amino acid. 500 is good, take 5,000. Well, why not take, 50,000, whatever, because more's got to be better. So it may be that what we're seeing in some of these people was that they were just taking a lot of tryptophan. What wasn't discussed in these papers was, well, what was the gut status, or what was the Candida or bacterial status of these patients? It's very well likely that many of these people who developed the EMS condition probably had some underlying chronic infection happening in their body anyway. They start dumping tryptophan into their system, and it just shoves their quinolinic acid levels up too high. So what are some treatment options for QA? The bottom line is there is no one treatment. It comes back to doing the fundamentals of integrative medicine. Doing your due diligence on testing, okay, organic acid testing, looking at gut function, possibly looking at viral infection, et cetera, if needed, but minimally doing the oat, getting people on supportive nutrients, improving their diet, okay, foundational supplements of vitamins and minerals and antioxidants, essential fatty acids, help most people. And then there can be certain types of antioxidants that can be helpful to nullify some of the damaging effects. Curcumin, polyphenols, broccoli extracts, resveratrol, etc. Talk a little bit about resveratrol. It's kind of interesting. When I was in China about 4 years ago, I found this article, and it was talking about resveratrol. This was actually done from the University of Shanghai. Resveratrol having a beneficial effect at decreasing activity of microglia in the brain and nervous system, causing a diminishment of brain inflammation. Well, resveratrol is a compound found in red wine and grapes. It's been shown to be helpful in things like seizures and oxidative stress, helpful against microglia activation. And I was at a A4M conference in Vegas some time ago. And I remember this was just at the beginning of the discussion of chronic traumatic encephalopathy in the NFL. And there was a doctor speaking who was the head physician for the Pittsburgh Steelers. And he gave a presentation on CTE and showed, not the same slides on microglia, but similar slides on microglia, that one of the things that's happening in CTE is microglia activation. And the research that he showed was trying to increase resveratrol consumption in football players. So I used to live here in Southern California. I grew up in San Diego, lived in Riverside County, Temecula for about 10 years, and we moved to Bend, Oregon about 5 years ago. And my neighbor is a family doc, been a DO there for 34 years. Turns out that his son played high school football for one of the local high school football teams, did extremely well as an inside linebacker, and got a scholarship to Oregon State. And so our neighbor Dan would go over and see the son's practice, and one day he walked into the training room and noticed after practice they had bowls of grapes. And so he got into a conversation with the trainer, and I think they even had grape juice. They didn't have wine. But so he says, well, what's it? He goes, well, what we have found is that when they come off a practice or after a game, the players tend to have less soreness. They tend to have improved recovery when they consume more grape juice and more grapes. So he didn't mention anything about resveratrol, but my mind thought, oh, well, that's probably what's happening, right? So feel free to consume your wine, okay? It's certainly not terrible, but but the thing is there are a lot of foods. I wish Julie was here. I could bring her up and say, what are all the foods that have resveratrol? There's a lot of them out there, walnuts, etc. So it's not just wine. But interesting about resveratrol because it certainly can have an antioxidant, anti-inflammatory effect. Medicinal cannabis, okay? There's a lot. Can't go into it now. There's a lot of research out there on medicinal cannabis CBD with regards to Alzheimer's. It's used quite a bit in autism, other types of neurological disorders. I think as it becomes more used in states, probably everybody here in California may at least know some things about it. I've seen amazing benefits with some of the autistic kids as far as aggression and self-injurious behavior, and clearly it can be helpful in seizure disorders as well. Lipoceutical glutathione, okay? That pyroglutamic marker is elevated. It's worthwhile doing glutathione supplementation. I really like this product. I think it works much better than oral powder capsules of glutathione, which I think just get pretty much used up by the gut. You can talk to Lori Knowles or Terry Herning over at New Beginnings. NAC, they mentioned as well, and acetylcysteine, curcumin. I mean, we could do a whole lecture on curcumin and the anti-inflammatory, antioxidant properties of curcumin. Curcumin is also a biofilm inhibitor of H. pylori. In one of the courses I do through our online academy called GI Mastery, we go into H. pylori treatment and the use of things like curcumin and other nutrients for H. pylori. Biochemically, I mentioned that a niacin deficiency could also increase the potential for quinolinic acid. So we need adequate niacin to help maintain healthy levels of tryptophan. Essentially, we use about 60 milligrams of tryptophan to produce 1 milligram of niacin. And if we don't have enough niacin, it can increase the potential here for funneling via access to the quinolinic acid pathway. This is a great website, by the way. If you really want to get heavy into the biochemistry over nutrients, the Linus Pauling Institute, the Micronutrient Information Center from Oregon State University. There's the website there, but you could just go to Oregon State University, do a search for the Linus Pauling Institute. There's all kinds of really great articles on nutrient biochemistry. Niacinamide. I work a lot with kids. They're not going to tolerate a niacin flush. So I'll oftentimes incorporate 1,000 to 2,000 milligrams of niacinamide when I see the quinolinic acid high, but it's not the only thing I'm doing. I'm trying to work on the whole package. But trying to improve niacin status can be worthwhile. Okay, so it's a combination of things when it comes to quinolinic acid. I can't go into it much more here, but one of the other things that can potentially lead to elevated quinolinic acid is the exposure to phthalates. Okay, phthalates are commonly found in our home. They're found in cosmetics and toothpaste and different types of things that we're exposed to, from plastics to shampoos and hairsprays. I don't know. Try and find something where phthalates might not be part of the equation. One of the reasons to also get familiar with the GPL tox test is it measures for phthalates. There is a marriage between that GPL tox and the organic acids test. One of the reasons I'm starting this toxicity mastery course is to help bridge that gap, to allow for practitioners to understand how some of these other tests can play in and what the potent power of some of these toxins can be and how we can deal with it in people who have chronic illness. Okay? So phthalates can inhibit this converting enzyme of quinolinic acid to NAD, causing quinolinic acid levels to elevate. So you can think of phthalate being like the inhibitor of dopamine beta hydroxylase. It just is another part of the puzzle here with regards to this problem. All right, thank you.